Big news in healthcare last week with the federal government's COVID-19 public health emergency officially coming to an end on May 11th. Why is this important? Because the emergency had been in effect since the very early days of the pandemic, way back in January 2020, and with its end came an end to a whole set of regulations that had been in effect for years now and that were fairly beneficial to the healthcare industry because they were specifically designed to make everyone's life in healthcare easier during the pandemic. Now, with this big change, a lot of attention has rightfully been paid to popular policies that came to an end, such as free COVID tests for patients and higher reimbursements for hospitals. But what I want to talk about briefly today is one important policy that did not end last week, and that is physicians' ability to prescribe controlled substances by way of telehealth. Of course, before the emergency, there was a federal law on the books that said you could only prescribe a controlled substance during a telehealth visit if you as a provider had previously seen the patient in person. But during the emergency, this requirement was waived, allowing telehealth prescriptions for controlled substances to be issued without an in-person visit, assuming, of course, compliance with all other federal and state laws. Now, earlier this spring, when the White House announced that they would be ending the COVID emergency, the DEA issued 2 new proposed regulations that would have allowed this practice to continue on a permanent basis, but only for a small group of controlled medications and just for one 30-day supply before a patient would have to go back to see their provider for an in-person office visit. Although this was less restrictive than the law before COVID, most providers and patients weren't happy about it, and in response, they lobbied heavily against this. And believe it or not, they actually made enough noise over the last few months to get the DEA to reverse its decision. So last week, just days before the emergency was set to end, the DEA issued a revised rule that said that all of its pandemic-era policies on this issue will remain in place through November for another 6 months while they try to figure out a better permanent and long-term solution. Obviously, this was a big reversal for the government, and long-term there are still some major policy decisions and a lot of nuances they'll have to figure out here. But I think the big picture takeaway is that some things in healthcare that happened during the pandemic that the government in 2020 thought would just be temporary, they're finding out now can't be changed back. And due to popular demand, they are now becoming permanent. And as we see here as a prime example, telehealth is at the top of that list.